Hi, I'm Jay Berlin. I'm the founder and CEO of Alternative Family Services. The biggest challenge this year obviously was dealing with COVID. So we had a lot of operation, most of it in person, training sessions, foster parent support sessions, staff meetings, everything had to be shifted to online. We did that without missing a beat. But that meant getting a lot of technology to a lot of people. Not every family had a computer. Not every foster family knew how to use a computer. Certainly the kids had to move from going to school to online learning. We had to get every single one of them some kind of a device to do that, which we did. You know, the greatest predictor of family reunification, that is to get kids out of foster care, to go back home, the greatest predictor is visitation. The more the families and the kids see each other, the greater likelihood that the kids will go back home. So we continued our visitation center all through the pandemic. We were very careful. When a foster parent needed a social worker to come out to the home, they did. We covered them with PPE. We were very careful. We did all the meetings that we could outside, but when we needed to be there and present, we were. I'm really proud of the staff about that.
My name is Alexis Salazar, and I am the Mental Health Program Director with Alternative Family Services. I've been with AFS for the last 3 years, and it has been such rewarding work. And really, I've watched the work change so much, especially in the last year, with how we've all been impacted with this COVID pandemic. It has been devastating to see how much of our worlds have been shifted in such a way that really impacts the day-to-day living, the routines, all of the things that were familiar, comfortable, and safe for our youth who already struggled with an added layer of complexity with being part of the child welfare and mental health system of care. Without being able to physically get out of that environment or physically get away and actually meet with their clinician in the community how they would, or coming into the office and being able to have a little snack and just break away from some of that busy routine has really impacted our youth in the form of not really knowing where is safe, where can I really let my guard down. That trauma is very real, and we need to treat it as something that is to be learned about and curious about and hold space for, rather than shun or shame or blame.
Hi, my name is Leslie Matthews, and I'm the Director of Foster Care and Adoptions here at AFS. I have been with AFS for 9 years, primarily serving out of the Sacramento area, but approving homes throughout the agency. One of the challenges we faced in the past year was distance learning. Really difficult on our resource parents and our children. Being home all day, not having outlets to get some of that energy out, and staying focused during the school times was very difficult for our resource parents. Finding resources, I mean, I could go on and on with the challenges, but I'm happy to say that our resource parents and our staff here at AFS supported our families so that we really didn't see a lot of placement disruptions. It was really difficult when the pandemic started, trying to figure out how we were going to continue normal operations. And our CRITA team, specifically our training team, figured out how to use Zoom and be interactive and produce good products and support our foster parents through training.
I am really proud of the staff and the families and the way that they adapted to this thing. It wasn't easy, and everybody knows what COVID was. We all of us in the world, not just at AFS, were fighting with having to deal everything on the computer, doing our work in a different way, the lack of human contact, but our people came through. It was really their finest hour. We had, I believe, about 1,000 kids go through the program since COVID began. So we were doing our job. We also operate an emergency placement program for the County of San Francisco, and we take kids in 24 hours a day. And that can be Christmas Day, 4th of July, 2 o'clock in the morning, we're there. So we didn't stop. You know, the general public thinks of grocery workers and delivery people and certainly healthcare workers as essential workers, and we're all very thankful that they are. But we're at AFS, we're essential workers too. When a kid is in trouble and that kid needs shelter, we're there.